to our Savvy series. I'm Catherine Magaña here with Rachel Ivanovich, and today we're going to discuss healthcare cost in retirement and what you need to know to plan for it. So retirement planning isn't just about playing golf, going on vacations, spending time with grandkids, living your best life ever, right? One of the biggest kind of expenses or things that come up are really looking at what is your healthcare expenses going to be in retirement, and what are those costs, and why does this matter? So when you look at retirement planning, you do want to factor in potentially in the future that you are going to have these extra expenses. But before we go into that, one of the things that I think as you're phasing into retirement and you're feeling healthy and everything's wonderful, you don't really expect to have higher expenses later for your healthcare needs. And so we're going to dive a little bit into that today, and kind of starting with, I guess, those that are turning 65 and those that are now on the Medicare plans.
So you may or may not know, if you are phasing into retirement and if you're almost 65, you have a 3-month window or a 2-month window before you turn 65, and then 2 months after to make sure that you are signing up for Medicare. Mm-hmm. And it's really important to understand what Medicare covers and what it actually doesn't cover, because there's a lot of misconceptions around this. And let's just go into it. There are 4 different parts of Medicare. We're not going to get super deep and nerdy about it, but you're automatically signed up for Part A when you turn 65, mm-hmm. but you need to be signed up as well for Part B. And so Part A, it basically covers your hospital stays, mm-hmm. skilled nursing facilities, and some home health care. It does not cover mm-hmm. long-term care. Yep. And most people don't pay a premium for Part A if they or their spouse worked and paid into Medicare taxes for at least 10 years. But there is a deductible for each benefit period. And for 2025, that benefit is $1,675. And then there's also co-insurance, and we'll talk about what deductibles and co-insurance is in just a second. Mm-hmm. But Part B of Medicare, which is a part you have to actually sign up for and pay a premium for, this covers doctor's services. So hospital is Part A, mm-hmm.
And
skilled nursing facility, and Part B covers doctor's services, outpatient care, and any durable medical equipment. It does also cover some preventative services. Mm-hmm. And in 2025, it does have a monthly premium of $185 for most people.
So it depends on your income.
Depends on your income.
If you have income. And then that also has the question is, sometimes if you're still working,
you need to be very careful.
Yes, so you may want to either, you can stay on your current employer plan, or you may do the Medicare plan. So that's where looking at the different benefits of both and the cost. And we do have a Medicare specialist that we work with. And so,
You've had her on the Savvy series.
Yes, so Pam Morton with Benefits from Design is definitely somebody we have connected with.
Her.
Yes.
Yeah. And she is very knowledgeable. So then there's Part D of Medicare, which is prescription drug coverage, and there is a premium for this as well. And this provides prescription drug coverage through private insurance plans. Okay. And this is also subject to that additional surcharge or tax that Part B might be if your income is too high. Mm-hmm. And just to really quickly touch on that surcharge, it is called IRMA, or the Income-Related Monthly Adjustment Amount, and it kicks in. It's determined actually by your 2023 bracket, so there is a 2-year look-back period, so you definitely want to be planning for that and looking at your income. For single filers, the first threshold, because there are multiple thresholds for the IRMA, is $106,000, and for married filing joint, it's $212 or less. So definitely want to be planning ahead for that. And then there is a Medicare Advantage Part C, and so basically this is an alternative to original Medicare, and this is offered by private insurance companies. Mm-hmm. And these plans cover everything that the original Medicare covers, and they also may offer additional benefits like dental and vision, because original Medicare does not cover dental and vision.
So Medicare Parts A and B, once again, doesn't cover dental, vision, and hearing aids, and most long-term care.
Which is random. Hearing,
yeah.
You would think.
So kind of looking at hearing aids, I did a little digging. It actually, if you have Medicare Advantage plans Part C, it could potentially cover, depending on what plan you're on, could cover the hearing aids. But once again, that ties into the cost. If you don't have the extra coverage, and there are a lot of times we have clients where they're calling us and they need dental work, and dental work can be very, very expensive. And we had a client, one client called in, she needed $10,000 for some implants. I had another client call in needing $30,000 to $40,000. It's like you start going down that rabbit hole. And it's really expensive, especially if it wasn't something you were planning for.
Well, for instance, I was sharing at the beginning of this podcast, or before we started recording, my aunt was was on the transplant waiting list for a kidney, and they told her she had to get all of her teeth fixed before she was able to qualify for the transplant. It was $14,000 just to get her teeth fixed. So that was a huge cost, and Medicare did not cover that. So this is one of the things you want to plan for in advance.
So let's talk a little bit about out-of-pocket cost and some gaps. So when you look at paying those different premiums eventually for Medicare, also you have potential prescription drugs you potentially have to pay for, and also the impact of inflation. So things are costing a lot more now. I know, at least for our healthcare plans currently, those seem to go up every year. And then potentially down the line, are there any hidden medical equipment expenses that you might need?
Right, because you're not thinking about that now.
No, and it's hard because you're healthy and everything's wonderful, but the reality is there might be some things. And sometimes healthcare providers, depending on what you need, they may cover it.
And it may be as simple as putting bars in the shower or a chair, a shower chair. But those are things that you want to be thinking about when you're putting together your financial plan.
Yeah. Another item that comes up as we look at financial plans are really having an idea of those final years. What's important to you? Do you want in-home care? Do you want to go to a facility? Or everybody has a different preference. But with that comes the cost.
Very high cost.
Yes, and it can be very, very expensive. And you can put some of those costs in your budget for it and know, okay, down the line, this is how much I want to allocate. There's different ways potentially that you can cover that. You can be self-insured and cover those expenses with your own assets in the future.
And you can get creative, like some of our clients, they're building ADUs or accessory dwelling units, so granny flats, and they're thinking, okay, somebody can move in there, and then we can pay them, some money throughout the month, but they can live there, and they're just going to take care of us.
Exactly.
So you have to get creative sometimes.
Yeah. And then there's some clients that potentially we look at long-term care insurance, or there's also now life insurance with long-term care riders.
Like a hybrid.
Mm-hmm.
Yeah.
And so there's some different ways to cover some of those expenses. Now you may not get coverage for everything, but maybe partial coverage with some of the insurance. So there are different ways, things to consider and plan for. Like I mentioned, it's when you're healthy and everything's great, you don't think about it. But this is big long term. We expect for life expectancies, we expect people to live a long time. Yeah. I met with a client last week, and her mom lived to the age 106. And
wow.
So, I was like, wow, that's a long time.
That is a long time. And honestly, I think the most cost-effective time to purchase long-term care insurance is generally in your 50s and 60s, and you're still healthy at that point, so you'd qualify for lower premiums. Yeah. And they are tax deductible if you plan correctly. So just keep in mind, long-term, it's not, so when you're younger, the full amount of your premiums are not deductible. So there's a chart, that kind of a phase-out chart. So in 30s and 40s, you can deduct this amount, and then 40s to 50s this amount, and so on and so forth. But you have to itemize your deductions if you're going to include those. One cool thing to think about is if you're self-employed, you actually can include those as part of your self-employed health insurance, those premiums. And a lot of people don't realize that is a deduction, which is basically it's above the line, meaning you don't have to itemize your deductions. But if you are self-employed, you can add that together, that long-term care insurance premium, along with your health insurance that you pay for. Yeah.
And then the other thing is, I guess, self-care and taking care of yourself as much as you can.
Yes.
It's like,
do the preventative care.
Exactly. I think that's obviously key.
Get the exercise,
as well.
Diet and exercise.
So a couple of planning strategies and things to think about are building in or making sure when we're looking at financial planning and retirement planning that we do, look at the healthcare cost and what your wishes are down the line. And usually when we do plans, we do some projections on estimates of what we think it might cost if you for long-term care, for nursing home or in-home care. Also, there's health savings accounts. So those are...
Health savings accounts are amazing. So these are, if you're eligible, they're
not everybody has access to either.
Because typically you have to have a high deductible health plan, but an HSA or health savings account does offer that triple tax advantage, which is tax deductible contributions. So you make it the contribution with post-tax dollars, take the deduction on your tax return, tax-free growth, and then tax-free withdrawals if you use it for medical expenses. And it does roll over year over year versus a flexible spending account, which if you don't use it, you lose it. So those are two completely separate plans governed by different sections of the tax code. But HSAs are great, but you do have to have a high deductible medical plan.
Got it. And then also coordinating your benefits with your spouse, and obviously looking at what you think your needs might be down the line, and different ages and life expectancies too go hand in hand.
Yeah. Actually, coming back to health savings accounts,
Yep.
I think under the One Big Beautiful Bill Act, they've expanded who can be eligible. So we'll have to dig into that and present more on that later. But I do think that they changed it going forward for 2026.
Speaking of the One Big Beautiful Bill Act, Rachel and I just did a webinar for WWM and Savvy Woman earlier this week. So
Did we send that out?
That will be coming out, I think,
Okay.
on one of our newsletters, and will be on our website. But that was definitely, there's a lot of different nuggets in there.
Yes. Yeah, we definitely didn't cover everything, but that was a lot for one day.
And then obviously it's important to work with your financial advisor, your tax advisor, and once again, being proactive with these conversations and really planning your future instead of being reactive. Because later down the line, it can be very, very costly if you don't plan. And we've also had clients, unfortunately, that have had to take substantial money out of their investments to cover some of the healthcare needs that they know they would need.
One of my clients this year, I thought this was really clever. They sold their home, and there was a substantial gain on the sale of the house, but they bought into one of the retirement communities. And if you plan it correctly and you do it in the same year that you sell your home and have that gain, you can actually, what the retirement community does is it factors what's the future value of the medical care cost, and then they basically give you a letter that says this is what the value would be to buy into this community. And if it was a substantial amount, it was like $100,000 or something that helped to offset the gain from the sale of their house. And so they plan on living there right now, independent living, just because they wanted to downsize. But then later, the medical care is actually available. And so they were able to use that future benefit to offset and reduce their taxes today. And I thought that was so interesting. I've never seen that before. So
we have a lot of clients that are, like you said, selling their home and moving in.
Yes.
And then they've been on waiting lists, and they're now ready to kind of make that move. We also have a client.
Go ahead.
We also have a client that unfortunately they waited too long, and then because you also get assessed for your health, and unfortunately they're not going to be accepted into this retirement community. So just talk to a specialist and do the planning and make sure that you're reaching the criteria that's required. But I definitely think that if you plan it right and that's where you want to be, there's definitely some benefits there too.
Tax-wise as well.
And then, but some people, they want, like you said, they want the in-home care. They want to,
They want to be at home.
Yeah. So it's kind of more, what your preference is.
Yeah.
So we talked a lot today about medical and retirement planning. And so if you'd like us to review your current situation and have this conversation with you a little more in depth, we're happy to do that. You can reach us at 760-692-5700. And thank you for getting savvy with us today about your finances. And then remember to savvy up. Please stay tuned for important disclosures. The opinions expressed in this program are for general informational purposes only and are not intended to provide specific advice or recommendations for any individual or any specific security. It is only intended to provide education about the financial industry. To determine which investments may be appropriate for you, consult your financial advisor prior to investing. Any past performance discussed during this program is no guarantee of future results, and the indices referenced for comparison are unmanaged and cannot be invested into directly. As always, please remember investing involves risk and possible loss of principal capital. Please seek advice from a licensed professional. Savvy Woman Wealth Management is a registered investment advisor with the SEC.